Alright, this is the pre-lab video for the anterior abdominal wall dissection. In the first step, you're going to remove the skin from the abdominal wall. I would suggest that you make sure that you get the entire abdominal wall, anterior and lateral aspects, and feel free to go a little bit into the anterior thigh region as well with your skin removal. That'll just make everything a lot easier. And what I hope you notice right away is the external oblique muscles that have the hands in pockets orientation, and the rectus sheath is going to be this dense tissue that covers up the rectus abdominis, making it so that you can't see that muscle. So if you remember from the lecture, the rectus sheath is composed of the aponeurosis tendons of the oblique muscles, so you might be able to see some of the fibers continuing into the sheath. One thing you might also see after you remove the skin, or as you are removing the skin, is the cutaneous branches of the intercostals in, which would be like these guys that you see here. These would be like the parts of the lateral cutaneous branches of the intercostal nerves. Or maybe near the midline you might see these anterior cutaneous branches of the intercostals. So have a look and see if you can find those in the surfaces of either the muscle or the rectus sheath as they come through. So that's going to be about it for your first sort of step. Then I'm going to have you make sure to orient yourself down towards the inferior end of external oblique and feel for sort of a thickening at the inferior edge where it kind of rolls under. That thickening at the inferior end is called the inguinal ligament. There it is. And I want you to go ahead and just sort of get a feel for that. That should be easy to feel in both males and females. And then if you follow that down to the medial end, you should be able to find this hoop or hole in the aponeurosis of the external oblique, which would be the superficial inguinal ring part of the inguinal canal. If you can expose that structure, you should be able to find the things that are passing through it. In the female, it would be the round ligament, which may not be a very appreciable structure. In the male, you'll definitely be able to tell there's the spermatic cord, which contains several structures. Here you can see the vas deferens, the testicular artery, the testicular vein, the nerve plexus associated with the vas deferens, the testicular nerves. These are all contained within a membrane and usually have some fat with them. And then there's also another nerve that will lie right next to the spermatic cord called the ilioinguinal nerve. It's pretty small, but this is one of the branches of L1 that will be running through this space, and sort of one of its trademark features as it goes through the superficial ring of the inguinal canal. Your next step is going to be to look behind external oblique and see what's happening at the next level of the inguinal canal. Remember, it's 3 rings. And I'm going to get rid of external oblique in a way that is a bit more aggressive than what you will be doing. You'll be looking at it a bit more subtly. But if you looked to the next level, you'd be able to follow these structures of the spermatic cord until they pass deep in behind the internal oblique muscle. This would be the middle ring of the inguinal canal. If you followed the ilioinguinal nerve, you'd notice that that actually doesn't go through the middle ring. It continues and it comes straight through the internal oblique muscle. It pierces through the muscle, separate from the structures of the spermatic cord. So it is a different structure. Here you may also find the iliohypogastric nerve, which is the other nerve from L1. And maybe if you go even higher, you'll find the subcostal nerve. So have a look for some of these branches as they make their way around. Okay, so that's that. Internal oblique, if you sort of look on it, a wider exposure of it, you'll notice that the muscle fibers are perpendicular to the external oblique fibers. That's sort of its trademark. This is most apparent in the higher part of the muscle, not so much down here. It won't be as obvious. They'll look more horizontal there. You might want to just spread some of the fibers of the internal oblique open to try and find some of the transverse abdominis fibers. We're not doing a full layer reflection because the transverse abdominis is pretty thin. It's tough to separate from the internal oblique. But it is there. Have a look, see if you can't see some fibers just by peeling some of the layers apart. And then this sort of shows you this issue of the construction of the rectus sheath being different above and below what's called the arcuate line. The aponeurosis of the transverse abdominis typically goes behind the rectus to form part of the posterior part of the rectus sheath. But below a certain point, below the umbilicus, the tendon or the aponeurosis of transverse abdominis goes anterior to the rectus. So the rectus sheath composition is really different. So let's look at this rectus abdominis real quick. You're going to cut the rectus sheath and reflect it open and expose the rectus abdominis muscle and see these tendinous intersections, which you'll probably have to cut off. They'll be adherent to the anterior part of the rectus sheath. But go ahead and expose this, and you'll want to look on its deep surface. We're going to cut it and reflect it, the superior part upwards and the inferior part downwards. And if you look on the inner surface of the superior part, you should find an artery called the superior epigastric artery. It's relatively small, but then on the bottom half, if you reflect that upwards, you'll find the inferior epigastric artery, which is really quite a bit bigger. You shouldn't have any problem seeing that one. So have a look for that on the deep surface. There's a few other structures on the posterior surface of the anterior wall that are more fetal remnants that I'll have you look for. They're not demonstrated well in the cybernatomy model, so I'm not going to try and show you them here. Okay, then the last thing you should do after you have the chest or you have the abdomen open is just do a once through of the abdominal viscera. If this is your first time in the cadaver's abdomen, some of these structures might not look as pretty as you'd hope. So you might want to just do a pass through the organs and see if you can't identify all the organs of the gut tube, and then the glands of the gut, like the liver, gallbladder, the pancreas, the spleen, some of those things that may not look exactly the way you'd expect. This is obviously a very idealized picture. So that's it for this dissection. I hope it goes well.